And welcome back. Well, women have different reasons for wanting breast enhancement surgery. No matter what your reason is, educating yourself on the newest types of implants is key.
Dr. Daniel Butz from Butz Plastic Surgery joins us today to show us advantages of some newly introduced implants. Great to see you.
Yeah, thanks for having me.
Here.
I'm very excited.
Absolutely. One of the things we've learned over the years is that breast surgery, augmentation in particular, is one of the most popular, most common surgeries that plastic surgeons perform.
That's correct. It's technically the second after liposuction, but it's over 300,000 are done every year.
Yeah.
It's continuing to increase in popularity every year.
So sometimes it's cosmetic, but other times do you work with women who've had breast cancer?
Absolutely. I do a lot of breast reconstruction, and implants are probably used in 80% of those. So it's a very common reason to use implants as well.
Yeah.
How about you? Now, you're a Wisconsin guy?
Yeah, I grew up in just outside of Green Bay. I went to medical school here at the MCW. And I spent 6 years at the University of Chicago for my residency in plastic surgery, and 1 year in San Francisco in a facial plastic fellowship. And then my wife and our 3 small children came back here to be closer to friends and family and just back home. So it's been great to be home.
Yeah,
it's great.
Welcome.
I always think it's wonderful when people are from an area and maybe they even go off to get educated or go to medical school like you did, but bring their talent and their skills back home is kind of a wonderful thing.
Yeah.
Let's talk a little bit about breast implants and sort of how they've changed over the years, because I think there was a time that a lot of people are familiar with, maybe quite a long time ago, where people were really nervous about certain implants.
Yeah, absolutely. And so implants first kind of came into the market in the 60s, and they were very thin shelled. The gel inside was very viscous, so if it ruptured, which was kind of common at the time because they weren't as durable, the gel could kind of go anywhere. Now, 60 years, fast forward 60 years, the implants are kind of all these gummy bear cohesive gel.
Yeah. And it's a much thicker skin, right?
Much thicker capsule, so the rupture rate after 10 years is 7%. And what's nice, we can actually cut this in half.
No way.
Hold the
Oh,
other
I
half.
gotta see. Oh, I'm gonna hold it.
You need to help.
Okay.
I won't cut you.
Juice all over?
No, it doesn't go anywhere. So it kind of comes out, but it's not going to spill.
Oh.
Wow. Okay, now kind of open that to camera so we can see. It
Let's
totally is like a...
So it maintained its
wow.
form
See?
stable.
That's
so you almost end up
wild.
with 2 different
So what
pieces.
kind is that? What is that?
This is a Natrel. This is one of the older models, and the newer, what they did recently in 2015, they released the Inspire line, and basically what they started doing is they filled the implant more, so there's less of the rippling.
Oh.
And then over the next subsequent years, in 2016, they released the Cohesive.
This?
Yep, and then the Soft Touch. So this one is a more cohesive gel, so it's even a little bit firmer if you feel it.
It is
Okay.
firm.
And this is kind of a Goldilocks, it's kind of right in between. And the benefit of having the more cohesive gel is there's less rippling. So for patients that have thinner skin, or especially reconstructive patients who have very little tissue kind of covering the implant, you get less of the rippling and kind of the implant showing. Versus the older, this is a saline implant. It's essentially,
You can see the water, like almost.
Oh,
the,
this is the old-fashioned one?
Well, this is just a saline implant, which is still used, but not, 5% of augmentations are performed with a saline implant, so not very commonly used.
And what about this one here? This looks very different.
So that's a form, that's a shaped, anatomical shaped
you hold
implant.
it. Okay.
So
Teardrop.
teardropped, exactly. So it has the same gel as this, so it's again cohesive. And I tend to reserve this for.
So we can see it. Keep your hand. There you go.
Reserve it for very certain cases where, again, very small amount of volume or skin kind of covering it, or reconstructive patients where they really want that natural appearance.
I always wonder, because if people have the unfortunate circumstance of having breast cancer and having a breast or both removed, is it sometimes the case that they, with reconstruction and healing, that they actually are happier with their breasts after the procedure than before they had cancer?
It obviously depends on what you're starting with, but for a lot of patients, especially as they age and breasts droop, they become, they lose a lot of volume. So with breast reconstruction, we're able to, restore that volume, lift the breast, and really, give them a pretty nice outcome. Especially if we can spare the nipples, it's really, the new nipple sparing techniques. It's a very good outcome.
Yeah.
And there's actually a newer technique that's kind of been developed over the last 5 years of putting the implant on top of the muscle instead of underneath, the pre-pectoral breast reconstruction. Which diminishes a lot of the post-operative pain and shoulder kind of dysfunction that's a little bit more traditional with putting it underneath the muscle.
Do people get a lot of choice when they come to you, or is it really you kind of talking to them, figuring out their anatomy and what's best for them?
Well, it's a little bit of both. For augmentation, the great thing about this line is there's over 600 implants you can choose from.
I wouldn't even know what to do.
Right, there's five different projections, so how much projection or profile comes off the chest wall. Then there's a varying degree of width, which is really determined on your individual chest wall width. You don't really want to violate that too much. And then the actual fill of the implant. So there's a lot of different options that's really customized to the patients, how how large they want to be, what their anatomy can kind of handle. And so kind of discussing, determining the goals and kind of what, we kind of come to a decision together about what they kind of are looking for.
Well, and to Tiff's point, I wonder too, if you look at someone and they say, oh, I want to be this size or I want this type of change, can you say by looking at them and giving them input, here's what I think is realistic for you or might really look nice, and kind of guide them through the process? Because if you have all those choices, I wouldn't know what to ask
right,
for.
and that's why you definitely, they're helping guiding things. I don't expect you to pick from one of 600 implants, but we narrow things down based on your anatomy. So there's certain things we can and cannot do. A lot of it is based on kind of what you're starting with. So that but it gives us a lot of different options to kind of get you as close to kind of what you're looking for as we can.
Real quick, because we're out of time, but to just kind of dispel a myth, can breast implants cause cancer?
No, they do not cause breast cancer. But just briefly, the one issue with these is that the texture is a newer thing called breast implant associated acute large cell lymphoma, which is a mouthful. Basically, it's an over-response of the immune system to the texture.
Yeah.
It's very rare, 1 in 6,000 to 1 in 30,000, depending on what kind of paper you're looking at. It's a little higher in Australia for some reason. But for a lot of people, that's why I often just kind of steer away from that, because they just don't want to have to worry about that. It's low risk, but still, it's just something you don't want to worry about.
But an important myth to dispel is that they do not cause cancer. It would be great for people to have a consultation. Right now, you actually have a spring promotional event that's $6,000 for silicone breast augmentation, which is a lot less than I've heard quoted in other publications and such.
You get both for that?
Yeah, great. Yes, both. It's a great promotion, a great spring promotion. Spring is a good time for breast augmentation. And also, on top of that, you can get a free, Botox treatment of frown line area. And yeah, I think it's a good.
You're good to go. Awesome.
Yeah,
that's fantastic.
Except for the summer.
So the Botox and the augmentation, $6,000. It's a wonderful spring promotion. Great thing to do a consultation to. Your office is located in Brookfield. It's on West North Avenue. It's 13800 West North Avenue. The phone number is 262-717-4000, or you can go to butzplasticsurgery.com. It's BUTZ plasticsurgery.com. Thank you so
Excellent.
much.
Thank
It
you
was
very
great
much.
educational information. We appreciate it.